The Gauteng Department of Health has instituted an investigation into the circumstances around the death of a 26-year-old patient at Helen Joseph Hospital in Johannesburg earlier this week. A Johannesburg mother found her daughter dead in the hospital's waiting area more than 24 hours after she was left in the same spot. In a statement released on Friday, the department said it had noted the incident with sadness. Head of Communications at Gauteng's Department of Health, Motalatale Modiba, says they will wait for the outcome of the probe.
As the Gauteng Department of Health, we have taken note with sadness the reported incident of the death of a 26-year-old patient at the Helen Joseph Hospital. The department has immediately instituted an investigation in order to establish the circumstances around the demise of the female patient. An update will be provided on the matter upon the finalization of the investigation. We wish to convey our sincere condolences to the patient's family.
We're now joined by the DA spokesperson on health, Jack Bloom, to weigh in on this and other matters affecting the health department. Mr. Bloom, very good morning. Very, very sad circumstances in which we chat today.
Yes, it's extremely sad, but I have to say that, the casualty department at the Helen Joseph Hospital, we've known for some time that they're heavily overburdened and that patients sit in the casualty, sometimes on oxygen, waiting to be admitted to the ward for a number of days. And the problem's been worsened by two things. Firstly, the COVID-19 pandemic, but also the continued closure of the major part of the Johannesburg Hospital. And this has put intolerable strain on Helen Joseph Hospital. And I really fault the Gauteng Health Department for not responding to the pleas of doctors at this hospital and increasing staff and frankly, why not reopen the Johannesburg Hospital as soon as possible? I mean, that's the major failure. I think this unfortunately is a symptom of the management failures, the corruption, the ineptitude, the wastage of money of the Gauteng Health Department for many years now, and unfortunately people suffer. And this is one incident. I can tell you there have been other incidents that won't be investigated. There's just far too many of them. But I hope that this is a proper independent investigation, and it doesn't just deal with this particular case, but the root cause. Root cause is financial mismanagement and corruption and the failure to reopen the Johannesburg Hospital as soon as possible.
Now, one of the things that you've expressed you have a problem with is the Anglo-Ashanti Gold Hospital. Well, certainly the contribution to that hospital, almost R500,000 rand, and when the MEC for Gauteng, Dr. Mkheti, revealed that the 175-bed hospital, I think only 26 patients since it opened in May have visited the hospital.
Well, yes, what this tells me is that the problem is not a shortage of funds. It's how it's spent, and it's spent badly. There was actually 2 billion rand that was made available last year when the COVID-19 pandemic hit us, and a quarter billion of that, 500 million rand, so that's a quarter of that total 2 billion rand. 500 million rand of that was, in my view, wasted on the Anglo-Ashanti Hospital in the far West Rand. They refurbished this hospital to provide ICU beds because that's the major demand and major need during this COVID-19 pandemic, particular provision of oxygen. And it turns out that, first of all, this hospital wasn't completed by the end of last year when it was supposed to be. Finally, they completed it, opened it with great fanfare in May this year. And it turns out that very few patients have been attended to, and they don't even have oxygen. Meanwhile, they've wasted 500 million rand at a white elephant of a hospital, whereas they should have been assisting hospitals like Helen Joseph. And I can tell you other hospitals that have been impacted by the continuing closure of Johannesburg Hospital. I can tell you Edenvale Hospital is very crowded, South Rand Hospital. Hospitals right around the province actually are impacted by this. Even Steve Biko Hospital, when they had to send cancer patients there. So I'm afraid it's a failure at many levels, And until we get to the root cause of the problems at the Gauteng Health Department, we're going to have many more, unfortunately, sad cases like this particular incident. But I think the way forward really is to have a rescue plan. We have very talented, skilled people in the private sector who can get things going. They know how to run hospitals. Why don't we bring them in and finally, once and for all, fix up the Gauteng Health Department? I've heard for many years in the Gauteng legislature, the Premier of our province say that the department is going to be turned around. Well, it hasn't been turned around so far. Whatever they've tried hasn't worked. I really think if they could get the best brains in the private sector to come up with a plan and implement the plan, because very often they have good plans but they don't implement for various reasons, and until we fix the underlying causes, we're going to continue to have very terrible incidents like this. And I hope we can really prevent this sort of thing happening again. Not just Helen Joseph. We had that terrible incident at Modiba Hospital last year where there was an investigation by the Health Ombudsman, and many other hospitals have exactly the same problem.
Mr. Bloem, give me some clarity here, please. You've mentioned or suggested a plan to resolve the problem, but you've also said that you don't know what the root cause is. How do we come up with a plan when we don't know what the root cause is of the problem?
No, well, the root cause is the continuing financial mismanagement, corruption, waste, general poor management. That's the root cause. I think that the problem is that they've never been able to implement plans that have been announced to fix it. So that's the real issue. I think what is it in the Gauteng Health Department that of years of promised turnaround plans, and we've had promises made before, and they've never been implemented. So I actually think it's because there's too much cronyism. I think there's too many political appointments, and I just wish that finally the Premier of this province, because it's his ultimate responsibility, gets to grips with this and really gets the best people involved. You see, it's actually quite simple. Put the best people in the right places and let them get on with their jobs. But for some reason, for many years, this hasn't happened at the Gauteng Health Department. We've had corruption scandals aplenty. We've had the Esidimeni disaster, tragedy, and we can't go on like this. I think that political appointees must go. It should be purely on expertise. It's a very large budget that the Gauteng Health Department has. It's over 60 billion rand. Spend it efficiently and effectively. Come up with plans and implement them. That's really what's needed to genuinely turn around this department.
Now, obviously, the health department has come back and said that they're investigating, going back to the issue of Helen Joseph, investigating the issue. But when we talk about investigation, we talk about corruption, a number of issues that you have raised in Parliament where the MEC has come back and said certain issues are being under investigation and no one actually has been prosecuted. What are you as the DA doing to put pressure, so to speak, on the Gauteng Health Department?
Well, one of the ways an opposition party operates is to ask probing questions. And I did that, and this week got a reply about investigations that the department has done since January 2018. It turns out that they've done 12 investigations, which have cost 17.5 million rand. I don't know why they have these costly law firms that produce investigations. The one investigation costs 3.4 million rand just for one investigation. Sometimes investigation costs more than the alleged corruption. And what happens with these investigations, only 4 of the 12 have been completed and not a single criminal charge has been laid. I'm just gobsmacked, quite frankly. And the problem is, they always say there's going to be investigation into corruption. And very often the plans, the report comes out. There's findings made and they just sit in a drawer somewhere. And it's not just the Gauteng Health Department, it's departments across the board in the Gauteng provincial government. So as the role of an opposition, first of all, uncover what is happening with investigations. And secondly, I'm going to be following up on this. I'm going to ask, well, what have you done with the findings of these investigations? Why are you spending so much money on expensive law firms when you could possibly do this in-house? Or is there corruption involved in the law firms that are given these particular investigations? I think the whole thing boils down to accountability. And that's what I hope we see with this latest Helen Joseph incident, that there's real accountability. But the accountability has to be at various levels. Obviously at the hospital, at the casualty department, but I think the rot is at the top. You've got to start at the very top of the Gauteng Health Department. Why do we have fruitless investigations with recommendations that are never implemented? If we can have proper investigations with recommendations that are implemented, then I think we can begin to see improvement in this department. South Africa is blessed with many health professionals who are very dedicated. They work under terrible circumstances, and they're just let down by management and frankly by the politicians in power. If we can fix that up, then I think we can get hospitals that do treat our patients with the dignity and care that they deserve.
Mr. Bloem, do you suspect that if so many investigations are being carried out and nobody's been persecuted, certainly over the last 3 years, I mean, you talk about 2018, I think one of the reports you mentioned online, do you suspect that there's collusion of some sort?
Well, I do suspect that. It's politically easy to say when there's a scandal that breaks out, we will be investigating. And then they have these endless investigations. We've seen this with the former president of our country, Jacob Zuma. Endless court cases, investigations into corruption. And what happens to them all? It's time that we got serious about investigations, and they mustn't drag on forever. Do them efficiently and effectively, and when they make recommendations, carry them out. So I do believe that there is political protection. Can I give you the longest running investigation and court action that's been stalled in the Gauteng Health Department? Dates back to 2008 when the former MEC was Brian Hlongwa, and there was alleged corruption of about 2 billion rand. This has just gone on and on and on. It still hasn't come to court, and former MEC Brian Hlongwa is still free, and nobody can tell us why he hasn't been prosecuted, along with senior officials who just stole money, quite frankly, from what we can see from the evidence. So I can tell you that a lot of the problems that the Gauteng Health Department experiences today date back to when Brian Hlongwa was the health MEC 12, 13 years ago, and we still haven't got to grips with that. So until we get proper accountability at all levels, I'm afraid terrible incidents at our hospitals are going to continue. I do think that there's a way forward, and that's to have the best brains involved, appoint people on merit, and get them to do the job that they need to do.
Well, finally, your thoughts on whether there's light at the end of the tunnel or not. I mean, all this brings into perspective the suspended health minister, Dr. Willem Mkhize, who himself is another cop for fraud or a tender that was irregularly awarded to the tune of 150 million rand. Well,
this highlights what I've said, that the rot starts at the top. And isn't it terrible that in the middle of this epidemic, our national health minister is suspended? I think he should be fired forthwith, quite frankly. The tourism minister is the acting health minister. I mean, this is appalling. In Gauteng, the former health MEC Bandile Masuku was also suspended because of an SIU report. Then he was dismissed, and we got a new MEC in December last year. It just shows you what the problem is. We don't put the right people in charge, and if you don't put the right people in charge, you get poor results. And at the end of the day, the patients in hospitals suffer and people die. That's really the result of it. As we've seen from this deplorable incident, nothing like this should ever happen again in any department of the hospital. If we don't set the example right at the top, this is going to happen again and again, unfortunately. But there is hope forward. Going forward, get all the expertise in the health sector to assist the department, and with the proper political will, I think we can turn the situation around.
Mr. Bloem, thank you for your time this morning. That was DA spokesperson on health in Gauteng, Jack Bloem.